Hello, I'm Dr. Dennis McKenna. Today I'm joined by Dr. Angela Antonikowski. Welcome.
Thank you for having me.
Angela is the Chief Officer for Health Equity, Diversity, and Inclusion, and we're going to talk a lot about that today. Let's jump in. Today is Thursday, September 24th, giving you the update from Albany Medical Center. We'll start with the COVID numbers. We don't need to spend a lot of time on them today. The first graph shows the 8 counties of the Capital Region. We continue to have the lowest numbers we've had in the last 6 months. And the next graph here shows Albany Medical Center, what it looks like when we came in this morning. We currently have 6 people in the hospital, 4 are on the floor, 2 are in the ICU, and none are on the ventilator. So we continue to have historically low numbers here, the lowest we've had in about 6 months, which is great. Last night there was a journal club, and so we'd like to recognize the people who put that out. Dr. Wales and Dr. Coates are incredible medical students, Dr. Leapow. So they spoke about the vaccines last night. And we've talked about Dr. Leapow before, and Dr. Leapow actually helped work on the polio vaccine with Dr. Salk. Right. And so she was giving us the insight about the history of vaccines. And as we talked about, as the COVID vaccine is approved by the FDA, we're going to very carefully look at how that's rolled out to our workforce. And so this journal club helped inform our thinking there. So we wanted to talk about that. So let's jump into you, Dr. Antonikowski. So congratulations, by the way.
Thank you.
You are our Health Equity, Diversity, and Inclusion Officer. And I want to talk about that, but I want to take us back a little bit and describe a little bit about your clinical background and your history here at Albany Med before this new job.
Sure. So first what I'd like to do is recognize that September is Latinx Heritage Month. So I just want to take an opportunity to recognize our students, our staff, faculty, and our patients who are of Latinx heritage.
For sure.
So I'm trained as a clinical psychologist. I have received my training here at UAlbany, my bachelor's and my master's and my doctorate. And I completed postdoc training here in the Department of Psychiatry. I spent about 6 years in pediatrics, and then I moved to family medicine. And in that work, I was really exposed to health equity, the community, and that had been work that I had been doing throughout my training. Right. But then, this opportunity really allows me to do that work on a broader scale.
That's wonderful. And I know that when this role was first identified last year under the leadership of the dean, you were obviously the best candidate for sure. And you've been in this role now since, when did you start this role?
July 1st.
July 1st of this year. All right, very good. Let's talk about the 3 different things in the title, because obviously they're different. Otherwise they would not all be in there. So let's talk first of all about health equity. What does health equity mean to you?
Sure. Well, health equity is achieved when everyone has the opportunity to achieve their full health potential. And that is important because the reality is that that is not the case. And so that leads to the issue of diversity. So diversity includes the spectrum of identities. So when we talk about diversity, we generally talk about many issues, but broadly speaking, we may be talking about sexual orientation, racial, ethnic minorities. We may be talking about language inclusion. We may be talking about ability status. We may also be talking about gendered minorities. And of course, there are other aspects. That links on, though, to inclusion. So it's important to have both diversity and inclusion. When we're talking about inclusion, that means that individuals on the spectrum of diversity are represented and stratified in an organization, right? Okay. So it's possible to have diversity, but then we may not have inclusion. And what we want is diversity and inclusion, because having those 2 pieces then leads to health equity.
The way you summarize it is wonderful, and this is why we need to have somebody with your skill and intelligence and passion in our organization to really help us on this journey. So you were recently featured in the Albany Business Review. There's a great article about you here. Actually, a couple weeks after this, you were actually named one of the Women Who Mean Business.
Yes.
So that was wonderful. So this says, her job, make healthcare inclusive. Angela Antonikowski has a new, broader role with Albany Med. And if you don't mind, I want to read an answer you gave, because I think this is a great quote. So they said to you, why is having a diverse and inclusive workforce so important for healthcare? And you said, in general, we know that a diverse workforce is much more successful in terms of income, revenue, patient satisfaction, and outcomes overall. We know that having a more heterogeneous workforce contributes to higher levels of creativity and thought, and also challenges the status quo. It stops us from doing the minimum and always raises the bar. And I completely agree with that. Do you want to expand upon that a little bit?
Sure. I think a lot of times when we begin to talk about diversification of the workforce, we move into a conversation where people try to understand, well, what are the benefits? There are numerous examples of the benefits, not only in terms of the bottom line, but in our case, in the instance of patient care, healthcare outcomes, in terms of research, creativity, right? And so we now have a public health imperative to really focus on this issue. Having a diverse workforce confers an advantage. It doesn't compromise any standard.
That's great. That's great. Well, thank you very much.
Absolutely.
Thank you for being here today. Jump in if there's anything you want to join in on as I go through the last couple items. But more importantly, thank you for helping us. Thank you for helping us on this journey. It's going to be great working together with you, for sure.
Thank you, Dr. McKenna.
We want to recognize our Daisy Award winner for the most recent month. This is a nurse on B3 West, which is our orthopedic surgical floor. And her name is Denise Shumway. So Denise was our Daisy Award winner. So I don't know if you've had a chance to see some. These are nurses who are recognized by patients who say, I think this nurse did a great job. And then once a month, we pick the one who is the winner. And Denise was the winner this month. So thank you very much to Denise. Also, you mentioned that we're recognizing a couple people this month. This is actually National Surgical Technologists Week. And I want to thank those very important professionals here at Albany Medical Center. We do the most complex surgery here in the whole region. And that requires a team of surgeons, members of the anesthesia care team, our nurses, of course, and the technologists who are very much involved in these important cases. So we wanted to recognize them this month as well. Finally, there is a couple things that have come to my attention recently from the workforce. One of them is, in the beginning of the COVID pandemic, we had to close access to the hospital to only a limited number of entrances. And we did that, obviously, because we were trying to control people coming in and out of the hospital. Obviously, very important. It's starting to get a little bit colder, and we're mindful of the fact that we might need to be opening up a couple more entrances. So that's one item. The second item is our workforce likes to drink coffee. And I certainly do.
Yes.
You're
yes. Yes.
And so we used to have ability for people to get coffee 24 hours a day from Dunkin' Donuts. But again, during the pandemic, those hours were closed down a little bit, and the overnight crew did not have that. So I think they call this a teaser. Stay tuned. We're going to have more information on both of those topics next week. And I think both of them are going to be good news for our workforce.
Fingers crossed.
Yeah, fingers crossed for sure. So we wanted to do that. So that'll do it for today. Any closing comments? Anything else you'd like to say before we sign off?
I'm really looking forward to this role. I'm really looking forward to working with the workforce. I'm really getting into the community as well.
That's wonderful. I know that you've been featured on a couple news broadcasts lately, and they were great. By the way, you're still working clinically too, correct?
I am. Yes, I absolutely am.
Which is great.
Yeah.
That's great. Okay. Well, thank you for being
Thank
here,
you for
and we'll
having
have
me.
you back for
this
sure.
was fun.
All right. That'll do it here from Albany Medical Center this week. Obviously, we always say on Thursday to the members of our workforce who are here over the weekend working, we thank you very much, and we'll be back again next week. It should be a beautiful weekend, so we look forward to that. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.